Hello, everyone. It's going to be a one-on-one, which we haven't done in ages. The other guys are taking a break, so I thought I would use this opportunity to speak to Elaine Miller, who's a brilliant new voice on, I don't know what you would call this, the GC scene. Elaine is Gusset Grippers on Twitter, I think. She might, I think that's her name on Twitter. She's going to correct me in a sec, probably. She's a physio therapist who says that she became interested in this. I'm just looking at her website, and she's saying that she kind of became interested in this when she gave birth to 3 giant-headed babies. And she realized how important it was to teach women about aspects of their pelvic area and show them how to be healthy and so on. So let me just bring her in, and I'll continue the story when she's in. Hi, Elaine. How are you doing?
Hi. Thanks for having me in. Pelvic area.
Sorry, I ran out of the language. I'm sure you'll help there. That's why I brought you in. Elaine, we met a few weeks ago or months ago, and you were still kind of, I think it's okay to say you were kind of undercover in terms of your turfery. And we had a conversation but we were speaking about the effects of testosterone and the possible effects of testosterone. And it was one of the most, at the same time, alarming and also kind of reassuring conversations I've ever had, because it was another conversation that made me realize, yeah, we're right. This is a very dangerous area. We need to talk about it. It's potentially causing great harm. How did you arrive at that position? Let's talk a little bit first about your history before you got into all this stuff. Why are you interested in the pelvic area?
Well, I just think genitals have got a bad press, and they're much more interesting than people think. Women aren't taught about what you can reasonably expect from your genitals in the course of your lifetime. And so I'm a pelvic health physio, and it's not uncommon for me to have women in clinic that don't have the faintest idea about what their own body should be and how it should perform. And that has huge implications for people's quality of life, because particularly for menopause, there's no way of telling women what menopause is. It's just left basically to Davina McCall at the moment, who is fabulous and doing a great job, but I'm not sure it's actually her responsibility. So by the time women come to clinic, to physio clinic, the average is it's 7 years that a woman's been wetting her pants for before it's so bad that she'll actually present herself to somebody for some help. And usually by that time, their life's completely disrupted, and I get increasingly frustrated about that in clinic, because they come in and they cry because their sex life's a disaster, the relationship's broken down, and they can't go out anywhere because they're worried about having an accident. And the frustrating thing with it is that most of these conditions can be helped, if not cured, with conservative treatment that's cheap to do. So pelvic floor exercises are cheap to teach, they're free to do, and the only side effect is giving you an improved orgasm. So it really shouldn't be that hard to sell,
Yeah.
So it's just misogyny that means that we don't have a vehicle to give women basic information about what their bodies are about. And when I was working in the NHS, I started to get concerned that I would have patients referred that were transgender and I wouldn't know what to do with them. So I started doing some courses and reading into it, and I just couldn't get it to make sense in my head. Right. From a science point of view. I understood gender dysphoria as a concept, and I understood the aim of the surgery. But what I then saw when I started having a lot of experience of working with the trans community, because there's not a big any community where I live.
Yeah.
But when I saw what the surgery was, I just thought, this isn't, it's not great. If it was any other area of healthcare, I'm not sure that you would accept a failure rate of 30%. I think that there's something really worrying about that.
When you say a failure rate of 30%, what exactly is failing in that case?
Well, it's quite hard to know from the data, because the published literature is pretty conflicting, and an awful lot of it, the science is really poor. The quality of the data is appalling. an awful lot of it comes from, or the stuff that I've read was from South America,
Yeah.
which has got a big industry in transitioning people. So it's not actually in their interest to report negatives. And even from the papers from Brazil, they were reporting a 30% rate of people that had, it was male to female surgery, they were calling it, and they were left needing to catheterize. So they no longer had any control over their urine. And because my bread and butter is people that are incontinent, the last thing that somebody needs that's got a dysphoria is then having to manage incontinence that they've got no control over at all. It's terrible. I don't understand why it's allowed.
So that's a 30% rate of people who have to have a catheter after transitioning.
Yes, but from bad science. So the way that the studies are constructed are not robust. I don't think that those papers would have got into, some of the bigger, more respected journals that we have here. But to be fair, the Cochrane reviews, so they're the body that look at all the science, and they've done work recently looking at trans women on hormonal treatment, and there was something else that they looked at, and the data isn't there. So they've tried 2 or 3 times to do a review, and the quality of the data is just not good enough to be able to draw any conclusions from, which raises some questions. Why are we doing it?
Yeah, yeah. I mean, that's the thing that I got into trouble for calling these things experiments, but they really are experiments, aren't they? There's no long-term research into how people are turning out because it's such a recent phenomenon.
Well, an experiment would have an objective, wouldn't it? It would have an outcome that you were measuring. You would be recording data as you went along. And what the Bell inquiry found was, or the Bell case found, was that Tavistock weren't even doing that.
That's right. They had no records. Yeah.
They weren't collecting the information. So I don't even think it's as good as an experiment. I don't know what it is. A hobby?
Yeah.
Not sure. It's certainly not medicine as it should be, which for 2,000 years is supposed to be based on first do no harm, because they can't prove that they're not doing harm.
And when we spoke, you started telling me things about testosterone that I had never heard before. I think you were the one who told me that one effect of testosterone is that it can fuse the ovaries to other internal organs. Is that right? Is that close?
Yeah, it's close. So female reproductive organs and genitals are all very estrogen thirsty. So you produce estrogen naturally from your ovaries until you're menopausal, which is usually average age is 51. And then your ovaries basically say, I've done my tour of duty, no more. And they get less efficient at producing estrogen. So the consequences of that every woman will feel is that her vagina and our genitals will change. So they dry up, basically. There's a drying effect. Yeah. There's also the change in the tissues can be quite marked. So when a woman's in her 80s, the appearance of her vulva is different. It looks just a bit less plump than in a younger woman because you change the volume of the tissue that's there, and that affects internally as well. So there's a strange thing that happens with young female people who are on testosterone, that they land up with the same presentation of vaginal atrophy as a woman who is long post-menopausal, because testosterone is such a powerful hormone, it knocks out the effect of the estrogen. So you're I can't find any data on this, but it appears that by taking testosterone, you're making this person menopausal.
Right.
Now, if you
had that shocking statement in your video that these procedures are putting young girls into menopause 30 years early.
Yeah, that's my interpretation of it. So if the average age of menopause is 51, if you're under 45 and your ovaries are not being efficient, then you're offered HRT as a preventative effect for coronary heart disease, osteoporosis, and dementia in later life. Because we know that, we've known that for 40 years. And I asked at a conference of a gender consultant, what is the protective effect of having a gender difference against this? Established, totally accepted. Nobody would argue with you that younger women who lose estrogen, it can increase the risk of consequences in their old age, and there isn't one. we know what we're doing to these young people. So we're already seeing, again, I haven't seen anything written up about it, but on social media, the young trans men that are, active on social media, then there seems to be an unusually high number of them, that are dying of heart conditions, which
Sharon
is not
Davis
unknown.
pointed out. Yes, Sharon Davis pointed out that her competitors who were on testosterone, who cheated the Russian competitors, they died young, didn't they?
Some of them, well, yeah, and again, we don't know because it was from the Eastern Bloc, so it's not information that we can access easily. But there's certainly anecdotal evidence that this cohort seemed to have a higher rate of cardiovascular disease than you would expect. Certainly in an Olympian, you can't get fitter as a human being than an Olympian. So there's something peculiar if they are then dying prematurely of something that's not related to, doping itself.
Yeah,
I'm really worried about it.
There's a trans-identified woman in Ireland named Noah Halpern, and Noah Halpern is constantly singing the praises of transitioning, is an advisor to the Irish government on the matter, and constantly tweeting about going to the hospital or coming back from the hospital. Yeah. I mean, the problems seem to get, like, when we talk about, I remember in the early days when I was talking to people about these kids being put on a medical pathway. The words medical pathway, I'm not sure if they're getting through to people. I'm not sure if they, like, I had cancer briefly, and the trips to the hospital were not enjoyable. You don't want to go to the hospital when you don't have to go. But these young kids are going to the hospital all the time. And the reason I brought up the thing about the uterus fusing with what does it fuse with? What is the uterus beside?
Well, it doesn't, what we think happens is that it atrophies. So that means just that it's shrinking.
It atrophies, sorry, yes.
Yeah. Now, I've got a small group of detransitioners that I keep in touch with, and some of them have very similar symptoms of really peculiar pelvic pain that doesn't quite fall into any other pattern that I've seen. And it seems to be linked with sexual activity in particular, but it's very debilitating, and they describe it as a sort of spasm thing. And even after, if they've had a hysterectomy, because most trans men will have a hysterectomy within about 5 years after starting on testosterone, and that's because of the spasm that they get. It's because of pain rather than because of any, gender dysphoria, because these are internal organs that you can't see. So, if you might as well be dysphoric about your spleen, you don't see it. It's not having an impact on yourself. So I think it's logical that what this small group that I'm speaking to are saying is right, that it's because of pain that they're having this surgery. But even after they've had their uterus removed or their ovaries removed, they're still getting this peculiar pelvic pain. So there's something going on, and it needs studying. It just needs some work to be done.
And of course, we both know what happens when scientists or any other kind of discipline tries to study these things. They're harassed and hounded by trans rights activists.
Yeah, sorry, what were you going to say?
No, go ahead, please take up on that.
Even for the community themselves to say anything negative, like a side effect about the process of transitioning, they get told very clearly that it's not helpful. So these people are really trapped because they can't say, look, I'm feeling better about my dysphoria, I'm feeling a lot more comfortable, I'm a lot less distressed, but this really hurts, because there's no space for that, it would appear, that's made. So therefore, how are you giving informed consent? How are you going to be able to provide appropriate care? Because there's a pressure on them just to go, yeah, it's great, I'm rainbow and happy, and actually I'm not sure that that's always the case.
Yeah. I mean, you've obviously been doing this for years, and you've got an Edinburgh Act about it, and your speech that I posted a few days ago that I really recommend everyone watch. It's absolutely brilliant, and it really needs to be seen. But like, you've been talking about this stuff, and there's obviously an embarrassment around women's bodies and everyone's bodies, I guess, but especially women, because there's so much. They seem to me so much more complicated than men's bodies. They seem to have so much more going on, and they need to be talked about a lot more, but they're actually talked about much less. that kind of embarrassment and squirming that that British people have about this, is that going to make your job and our job even more difficult as we try and get across to people the dangers of what's going on? Is squeamishness one of our biggest problems here?
Yeah, because it leads to not knowing the facts. If you don't know what normal is, then you're not going to recognize something different. If when you look at the cohort of young people, young female people that have that start to express gender differences when they're coming up to puberty, well, puberty is uncomfortable. It's essentially normal to think, oh my goodness, what's going on with my body? And if we taught puberty at a more effective way to that age group, because the age of puberty has reduced over the last even 2 generations. It's very different now, that you would expect it's not unusual for a girl of 10 or 11 to be menstruating, whereas 50 years ago you would expect it to be 15, maybe 16, and so it's really changed.
Wow, that's happened in 2 generations.
Yeah, they think it's to do with body mass, because you have to get over a certain percentage of the kilos before your body will start to menstruate. Because we're less active, because we're all sitting on screens now, they think that's partly to do with it. Which means then if you've got a 10-year-old that's dealing with our body changing and producing hairy bits, that from a developmental point of view, they're just a different creature from their mother was. It makes sense to me that we just need to be teaching them younger. Millie Hill's just produced a really good book about periods for younger girls, how to talk to your tweenies about the puberty changes, and it's excellent. The squeamishness is very difficult. It usually comes down to sex and being sexually active, and there's lots and lots of feminist theory about women and sex and what we should or should not be doing, and there's many rules in many countries, and it's just a bit icky. But what the trans community, not for me, I am the most embarrassing mother ever. What the trans community don't seem to be, what I don't understand about that group is they understand genitals really, really well. Obviously they do, because they've established that theirs are making a source of unhappiness and they want them to change. But the post-transition people, especially the female people, are then surprised to find that they've got vaginal atrophy. They didn't know that they were going to have aching joints. They didn't know that they were going to have tiredness and exhaustion that you would associate would be normal in a 50-year-old woman. And I don't understand why that information is being missed, except my conclusion is that the people that are giving advice to these people are not medics, they're not psychologists, they're not got a science background, they're lobbyists. And they do their own research, they gather their own data, and then they present it as if it's quality that would be worthy of being in a peer-reviewed study. And most of the Stonewall research, if you actually look at it, it's just opinion. It's not great.
Do you know about have you heard about the grievance studies hoax that James Lindsay and Helen Pluckrose did, and Peter Boghossian? Yeah.
Vaguely.
Well, they submitted a group of papers in for peer review, and they made up just nonsense. And they even did things like they tried to get this one didn't get successfully submitted, but too many of them did. They got a bit of Mein Kampf and translated it and tried to put that in, and they almost got it in. And they say that what's happening in academia in America at the moment is that a fake body of knowledge is being assembled by these grifting academics citing each other. So you have someone saying, as such and such says in this other peer-reviewed paper, but the other peer-reviewed paper is a load of nonsense too. So when people say, follow the science, or you don't understand the science, they're referring to this fake body of knowledge. I mean, have you ever said to yourself, what is the most compelling scientific argument for any of this, and read it or looked into it? Can you find anything that points to a successful outcome for people who are transitioning, women, especially women?
I've not looked at that specifically, and I'm not an academic, so I wouldn't trust my conclusions either, because I'm really aware that I'm dabbling in this. I have read lots about how to read a paper. I think because I know what I don't know, I would check with somebody else and say, what do you think of this? So I've done that. And I remain confused about how they're measuring the outcomes of these interventions that they're doing for the people. So anecdotally, there's lots and lots of trans people that are completely confident that their outcomes are better, that they are definitely happier, they're definitely more settled in their body, they're definitely more content. But it is interesting that the people that are having these interventions seem to have a higher predisposition for neurodiversity and for, you know, adverse childhood events and for other like comorbidities like bipolar disorder or borderline personality disorder or anxiety and depression. And I don't see that anybody is looking at why that might be. And my worry about that is, well, if you're autistic, there's a link now between autism and anorexia, because that's also a dysmorphia, or a dysphoria. So why are we not examining it? I'm not convinced that you can say that they're happy unless you measure what their baseline rate was, and nobody's doing it.
Yeah, and also, you know, as I say about this person, Noah Halpern, the expression of happiness seems very different from the reality of her life. You know, she's going into the hospital all the time. Why? It's not a nice place to go, but she has to because of these procedures. You know, it's fascinating, isn't it, that the thing that gets thrown against us all the time is that we are putting trans lives in danger, and we're you know, and we're affecting trans healthcare. But it seems to me that trans healthcare is essentially lying to children. Like I don't know if you saw the woman who got pregnant, trans man who got pregnant, and didn't think she was able to get pregnant because she thought that transitioning was. I mean, it's shocking the levels of this information.
That I would be really interested to have that case examined as to see why that happened, because it's possible that the person didn't understand what they were signing up for, because in a clinical situation we know that a patient only remembers about 10% of what they're told, because it's a weird situation to be in. It's a bit overwhelming, it's out your comfort zone, and actually retaining what the doctor or clinician wants you to know is a challenge that you need to be really good at communicating. So it's possible that they were told that you can still get pregnant and they just haven't retained it. In which case, that's a responsibility that the gender clinic themselves needs to be really aware of and find a different way of disseminating that information to this population, because they have to know. It's completely irresponsible. It happened in the States as well, with that very, very sad case where a trans man went to A&E and told the triage nurse that he was a trans man, but the triage nurse didn't pick up what it meant, and they had whatever the equivalent was of a gender recognition certificate. So the person's medical record said male, didn't say female. And because the presentation was abdominal pain, then they were treated as if they were male. Nobody did a pregnancy test, which would be the first thing you would do if it was a woman presenting with searing abdominal pain that came and went and came and went. And by the time they realised that, in fact, this person was in labour, the baby had sadly died. And that person didn't know that they were pregnant, went into premature labour, said, I am a trans man, but the confusion in A&E, where it's very, very busy, and you're talking to somebody that is, you know, in pain, off their face on drugs, not very well, it's awful. And it's doing harm.
Yeah, and also we have now, of course, the obfuscating language, like with people with a cervix and language that bizarrely has even entered the NHS in official documents and so on. What's that doing to our understanding of ourselves and our bodies, and our doctors' understanding of us and our bodies?
I'm very, very, well, I was going to say concerned. I'm raging about that. I'm absolutely apoplectic, because yes, gender inclusive language is very important for the individual patient, because you want to do patient-centred care. But unless you do an impact assessment to see what the consequences are of changing language on the rest of the population, then the assumption is that this is just a really nice, kind thing to do. And it completely excludes the people who have English as a second language. So if you're talking about cervical screening and saying if you're a cervix haver, cervix is not a common word. So if you've if you've not got good health literacy, how are you going to know what a cervix is? You can't see it. You don't read about it in the daily newspaper. It's not a thing, a word that you're familiar with. You have to use the word woman. And I had started looking at this because I realised through a colleague of mine that I'd never seen in 30 years a woman with a learning disability in my clinic. And I thought, well, either these women don't get prolapse or they're being missed, one or the other. So guess which one it is. And so if you're trying to communicate with women who are already really marginalised because they've got a learning disability, and then you stop using the word woman, you're never going to be able to reach them. And those women, you know, I hear a lot about how the trans community are the most marginalised of any. I'm not convinced about that, because all of the trans people that I come across have got tertiary education. They have degrees.
Yeah. It is a middle class phenomenon. You know, there's no question.
You can't possibly compare yourself to somebody who's got, you know, a global comprehension problem and a language problem. And what are they talking about?
Are you okay?
Yes, I'm just I'm trying to be tactful. I'm trying not to say Jesus wept.
I know,
because it's the change of language creates victims. They're told, you know, my children have you know, friends that are transing, and these are teenage kids, and they are told by the organisations that are supposed to be helping these people and standing up for them, they're told you're hated. They're told you're going to experience transphobia, you're going to be discriminated against, you're going to be made to feel uncomfortable. Well, if you tell a teenager that, they're going to believe you. And actually, I get really cross about it, because in Scotland, where I stay, there has never been a trans person murdered since they started records in '96 when the Scottish Parliament opened. So in November every year, we have this sombre ceremony at Holyrood for Trans Day of Remembrance, which is a good thing, but it's sombre. And it's saying, oh, this is terrible, look at all these people that have lost their lives, which is always a tragedy. But the point in Scotland is nobody's ever been killed in Scotland because of the trans status. We should be having a carnival. We should be celebrating that everywhere. But the framing is you're going to have a really hard time because you're trans. And it's not necessarily true. I'm not saying there's not transphobia. I'm not saying that they're going to have a great life with everybody being, you know, inclusive and welcoming. But the way that it's framed by the people who should be more positive about what being trans means is bemusing to me. I don't understand it.
I think one of the cruelest things that trans rights activists ever did was try and convince trans people that J.K. Rowling hated them. You know, like most trans kids will have grown up. So sorry, I use that phrase. I don't believe in trans kids. I don't think that that's a useful way of describing kids with gender dysphoria. But most of these kids have grown up reading her, and then to be told that she hates them and wants them to die, that type of hyperbole, you know. And this is kept on a high pitch throughout this conversation. So even when you, for instance, Elaine, might be saying something that really could save these girls some pain and some you know, distress in later life, they won't listen. They will never watch this, for instance. They won't hear the arguments. It's right. How do you think we can get through to the people who don't want to listen?
By debunking what lies they're being told, and I'm using the word lie mindfully, because the data that Stonewall is putting up is not good enough. It's not reliable. And so I would look at every single piece of information that has been put out. I mean, I'm saying Stonewall, there's more organisations, but they all fall underneath the Stonewall umbrella.
Yeah.
And to be honest, everything that I've read that's been come out of that organisation since Ruth Hunt was in charge is not worth the paper it's written on. And so I would get a body of different experts, get legal experts, justice experts, criminology experts, and health experts, and sociologists and philosophers to really look at what they're saying and unpick it. I would do that as a matter of urgency with mermaids, because they seem to be an organisation that are run by patient experts, and that's really important, that you listen to the voice of the people that are using the service. That's vital, otherwise you're never going to get anything right, and that's a fundamental problem within women's health, that the Royal College of Gynaecologists have done a heap of really good work to try and improve women's voices actually forming things. So I wouldn't criticise the point of having a patient expert,
but they're all patient experts.
They have bias, and so
Yes.
if you've made a series of decisions that then you want to have justified in your head, then you have bias, and I don't think that you should necessarily be the voice giving advice to thousands of children.
Something came up in the Weberly, Helen Weberly. By the way, I've been really remiss in not tweeting about Tribunal Tweets is now doing, is it David Weberly?
Mike
Weberly. Tribunal Tweets are doing Mike Weberly's Tribunal at the moment. And if you're not following it, you really should. There's already been some extremely shocking stuff coming out of that. But the thing about Weberly that fascinated me about her case was that when they asked her where she got her expertise from, she said Susie Green. She said she listened to Susie Green, and Susie Green's only kind of credential is that she decided her child was trans at a very young age because the child was playing with women's toys, girls' toys, and the dad didn't like it. I mean, she admits this on her TED Talk, you know, and that was the expert that Helen Weberly was deferring to. It's extraordinary. It's just a complete, like, it's based on nothing.
I can't find a training course that is focused on science. Most of the training that I've done, and I've done, you know, as much as I can find, is mostly concerned about the use of language and pronouns in toilets, getting things right. And I got into trouble on a professional forum. So there's, I mean, fanny physios, pelvic health physio is a very small world. And there's a professional group, it's an international group, and somebody posted a clinical question that I answered, and because my answer didn't suit the narrative of just waving pom-poms and saying, hey, now you go girl, you live your best life, and I was critical because I had clinical concerns about the outcome. I had this massive pile-on from my professional peers that went on for days, and it was very, very personal, and I was told that I wasn't fit to work with trans people because I wouldn't say what the accepted script was, because I'm trained to be an independent thinker with critical thinking and evidence-based, and I don't know why we've stopped doing it for this one field, because they really need it.
Yeah, I did an interview with Stephen Nolan recently, and he was sympathetic, but he pushed back on a few different things. And one of the things he said was, I may not have made the final edit, but at one point I said, you know, these kids are taking hormones and they're changing their bodies and they don't know how. And he said something like, but it's their choice and they're doing it because it makes them happy, and they're doing it. He said something like, he made that kind of counter argument that is, I would say is the kind of standard counter argument, you know, because he's giving voice to what a lot of people say. But it seems to me that this was all, transitioning was always supposed to be the last stop on the train lines. And because of people like Susie Green, Mermaids and Stonewall, it's now the first stop. I mean, it literally is the first thing that people suggest. And we have, you know, like, I get frightened when I hear that your young person is in therapy, because I just think, is this going to be a therapist who decides that my child is trans, you know, or is this going to be a therapist that kind of encourages that type of ideological, you know, what would you call it? Line, I guess, you know. It's just, it's extraordinary. It's extraordinary how it went from being absolute last ditch, like your dysphoria is so bad that you have to deal with it, to the very first thing you should do. The very first thing you should do is have a double mastectomy, for instance.
It's even worse than that, because, you know, I do have, it's not a big cohort, but there are a small group of trans people that I'm in touch with to support them from a physio perspective. And there's a significant number of people that are now buying medication online before they get anywhere near seeing a consultant. because the waiting lists are so long. You know, it's 3 years before you get seen here, which is terrible because these people are in distress, they have a need. But 3 years is a long time to suffer for anything from. So they go online and they find Reddit and places that have got advice about how you source illegal medication online and how to do it. There's a person that's doing private blood tests in Scotland, and she'll come to your house and do the blood tests. She's not qualified. She's not. It's easy to take blood. That's not the difficult bit. The difficult bit is getting it to somewhere, a biochemistry lab that can process the blood while it's still usable. And I would not be convinced that she's able to do that properly. But these people are they're either under the care of the GP or a gender clinic, and they're adding to their prescription because they want more testosterone, because the culture online is saying, yeah, you just take a bit more, it'll be fine, you'll transition more quickly. And so then they're trying to monitor it so that they're not messing up their bloods and getting caught by their GP. It's really, really bonkers, because there is no other patient group that I've ever heard of that operates in this way. I'm unaware of any other patient group that's got such power that they would turn up to a clinical appointment and say, this is my diagnosis and this is the treatment that I want.
Yeah,
you wouldn't do that for anything else.
I read a brilliant piece that I'll send to you, Elaine, about the effect of Tumblr on all these kids, the coaching of each other, the kind of grooming. There's a brilliant detransitioner named Helena who wrote a fantastic piece about the effect of Tumblr. Have you been looking into social media's effect on all this at all? Are you following that?
Yeah, informally, because 3 friends of mine had young kids, all girls, all teenagers, who all announced that they were transgender in exactly the same way. So they all did it through the power of a cake. They baked a cake to make a gender reveal tea party. Yeah. So these 3 kids, they don't even live in the same countries. This is an international thing, but they are similar nature children. And the letter that they gave to their parents was a script. So I've seen all 3.
Really? Wow.
Yeah. And it's not written by a 13, 14-year-old child either. That's written by somebody else, and they've copy and pasted it and performed this rite of passage of, this is what we do to do our gender reveal, and ta-da, now I'm a boy.
So 3 people in 3 young girls in different parts of the world all did the exact same thing.
All in my social network. These are friends of mine, not in my professional network. Yeah.
That's extraordinary.
It needs looking at. It's very peculiar.
Will you send me that letter? I'm not sure if it can be published or whatever, but I'd love to show people the kind of, we use the word grooming often, and I think it's an appropriate word. I do think it's appropriate, but that is the best example I've ever heard.
Well, I don't know that children might be able to quote J.K. Rowling's work, I suppose, but this is the only thing that I've ever seen that is, it was really startling. Like, it took my breath away, going, where are they getting this from? Because there's somebody that's motivated enough to influence their culture and their thinking, because culture is now generational because of the influence of the internet. And this small group of kids that are just new teens, somebody's influencing them, and I'd be really interested to know why, because that's not coming from anybody that's got a medical insight, something that's positive for them. There's people making an awful lot of money out of this, not so much in the UK, but in the US.
I think also, I'm afraid to say, we're getting into very dark areas here, but I remember one report about the Tavistock, that one of the doctors felt that the father who had brought the daughter in was abusing her. And he felt that he wanted to keep, this doctor felt that the father wanted to keep the daughter in a pre-pubertal condition by removing her breasts, giving her puberty blockers. It's one of the most shocking things I've ever heard, and still it hasn't broken through to the mainstream. That story just, Times readers know it, GC people know it, but no one outside of our world knows it. These stories just don't travel.
And the effect of blockers, so puberty is not just about, growing breasts and pubic hair. It's a whole physiological process. So if your brain doesn't go through this system and then you age out of the period of time that you can go through puberty, what's the ethics about that? Are you leaving them as eternal juveniles? And there's just been an article in the BMJ just this week about the ethics of non-binary people who are being put on puberty blockers and who don't want to come off them. So if you're 30 and you're still on puberty blockers, well, that's completely inappropriate because puberty's long since gone. And what's happened to you as an individual? Are you capable of giving informed consent? Because are you actually an adult? You've not gone through puberty. So what happens when this person wants to get a mortgage? You wouldn't give a child that responsibility about their finances. So if somebody's not gone through puberty, should they be able to make these sorts of decisions? Or do we need to have some sort of safeguarding set up around them, like you would somebody that had an intellectual disability? Because we've not had any medical ethics or philosophers examining what's going on, then we're in this appalling situation that I think people, the trans community themselves, there's aspects of this situation that make them very, very vulnerable, and not in the way that they're being told that because people are going to call them horrible names. They are prime for being taken advantage of.
Yeah. It like, and the other aspect to it is, the constant calls for trans healthcare, which I think to the ideologues on the other side means letting young women take testosterone and cut off their breasts as soon as they want to. But the real trans healthcare, the real crisis is going to come up in a few years when people start realizing what they've done to their bodies. People start suffering because of some of the things you've been talking about. I mean, it's a mental and physical health crisis just around the corner, isn't it?
I'd like to disagree with you. I really would, but no, I have got concerns. Part of that is because the waiting lists are dreadful, and Scotland has committed £9 million in the next 5 years, I think it is, that they've got £9 million to spend to try and improve the care for the trans community, which is a good thing. It's an awful lot of money considering that the Scottish Trans Alliance got 5 million, I think, previously. But anyway, there's work to be done, and it's good that it's been funded. However, what are they going to do? Because what the trans community seem to want is to be seen as quickly as possible. That's completely reasonable. And then be told, yes, you can have what you want, rather than having a process of differential diagnosis, ruling out things like neurodiversity to make sure that this is in fact a gender dysphoria and not something else. And then they want to have access fast-tracked to the treatment. Like you're saying, historically, these are lobbyists who are saying this is the best patient pathway, and there's no evidence that I can find to support that. There's nothing in place for, I've got a concern about having a double mastectomy, because in the olden days in the NHS, if you had a single mastectomy because of a disease process, then you would get physio to make sure that your shoulders worked afterwards and you didn't lose shoulder movement. If you have both breasts removed at the same time, then your risk of getting tendinitis and having difficulty putting on seatbelts and getting things out of high kitchen shelves is going to increase. Now, largely those services have been pulled because of COVID and because of cuts and things like that, but the science is still there. And there is no, to my mind as a physio, there is no, I can't see any sense in what the American clinics are telling these young people. They remove both breasts, and then you don't lift your arms above 90 degrees for somewhere between 3 weeks and 6 months. Right. Depends on where your clinic is. Yes. So it's interesting to me that when the young trans men are they're on social media and they're in the gym, they're doing their training, I've not seen any of them doing lat lifts.
Right,
They're all doing biceps things, and I think they've lost the movement because they've been told, don't move it beyond there. It's got consequences. These are plastic surgeons. These are not people that understand about shoulders. So what are they basing the advice on? And it seems to be related to that if you move your shoulders too much, then your scar will widen.
There's a really strange. I saw it the other day with Elliot or what's her name?
Paige.
Paige at the Oscars, and it said something about how Paige, is finally able to wear a tuxedo.
Yeah.
And it's like, you could have worn a tuxedo when you were a girl. And I saw another thing on the BBC, which I think also has to answer for their behavior over the last 5 years, where there was an interview with a young woman in an audience, and she said she was wearing a binder, and she said it hurts and it's difficult for me to breathe because I transitioned because I wanted to play football. And it was like, you can play football as a woman. What is going on? You know?
Yeah.
So this woman, I know someone says she's still a girl. I know that. But there's like, she's restricting her breathing. She's causing herself pain because she wants to do something she could have done anyway. It's insane. You know?
And in that age group, so the young girls, that sort of 14, 15, that's the age that they drop out of exercise, and that has lifelong effects. The biggest cause of death in Western societies, industrialized nations, of women is diseases of inactivity. So we really want these kids to keep playing. If you want to play football, great. One of the things that came out of Caroline Criado Perez's work, Invisible Women, which is a great book that everybody should read, was the organisation, I'm going to get this wrong now because I haven't thought about it, is it Make Space for Girls? Yes. And they're looking at the sexism in play parks. Right. And as usual, it's just two women that got cross about something and thought, right, I'm sorting this out, and started engaging in town planning and finding out why young girls don't go and exercise at play parks. They'll go to a skate park and they'll watch the boys skate, but they don't skate themselves. They'll go and sit on a swing, but they don't actually physically swing if there's boys around. So that they're looking at why these girls don't move. And often it's because the boys can see what they're doing and they get catcalled, they feel self-conscious. So these two women are trying, it's called Make Space for Girls, are trying to get parks designed so that young girls will still be active, because it's vital for our health. A baby girl born today has got a 33% chance, if she's not born into poverty, a 33% chance of living until she's 100. It's, if your long-term quality of life is going to be good, you have to move. And putting yourself into a binder at 13 is going to have a huge impact on the amount of exercise that you do, the enjoyment that you get from exercise, and therefore the likelihood that you'll keep it up for the rest of your life. It's also really problematic.
And I don't think they tell these girls as well that you lose all sensation, don't you, in around this area. So these girls are never going to, I mean, it's like when you lose your sense of taste during COVID. I've seen people who've lost their sense of taste forever, and it's very debilitating. The lack of feeling that you're alive in one part of your body. It's. I don't think they're being told any of this.
They're giving up. You see that really commonly in women that have cesarean section deliveries of their infants. You can get a particular band of numbness because of where they do the incision. And even that can be really bothersome when you're an adult. And because of, these are erogenous zones that are being operated on these young kids, before they've got any experience of what, I hope, of what sexual activity is. They've not experienced sexual pleasure. And yet we're removing the nipples and believing that these kids are consenting to it. I don't know that is okay.
Have you seen unless... I was just going to ask, have you seen the non-binary operations? Have you heard of these?
I don't understand that. I don't understand it at all. I've only seen it online. If non-binary doesn't have a definition, which is something that Tolan's podcast established really well in whatever episode that was, is it episode 5? I think they interview the guy.
Yes.
The person that was I'm usually very good at that, but it's the mayor in Wales.
Oh, and you can say he's a chancer, Elaine. Come on. I mean,
I tell you what he's not is somebody that's able to define what he is.
Yeah. Exactly. And again, he's a great example of how the non-binary tag, if you're a man, you say it and you just have to say it. But if you're a woman, they're encouraged to cut off their breasts. They're encouraged to take, you know what I mean? There's different rules for women. And it seems to me that women get the shit end of the stick every time when it comes to transitioning.
Yeah, I would agree.
Yeah.
It's
Yeah.
really, it's fascinating because there's no other area of women's health that we get the priority and we get the most intervention, not for funding for research, not for increased
Yeah.
services, not for anything, but for this.
Yeah. Yeah. It's so true.
It's worrying.
Yeah, we've gone down some pretty dark roads today, but there is
I
one
know.
more. I know it's been much darker than I thought. I thought we were going to be laughing our heads off. But like, I want to end with a couple of things. Like, first thing is something you said that was absolutely fascinating. I think more people need to know about, which definitely does speak to the idea, as I think you pointed out, that a trans person's trans status is innate. You know, which is people who, well, could you explain that aspect? I think you know what I'm talking about.
Yeah, so Stonewall say that your trans status is innate and everybody has a trans status, which a colleague of mine
Or everybody has
me,
a gender identity, not a trans status.
sorry, yeah, you're right. I got that wrong. Yeah, gender identity. Now, I don't have any feelings of gender myself. It's not something that I'm aware of. Just like I'm not a person that's got a strong faith. I can recognise that other people have, and I respect that. But it's not a sense that I have myself. And I feel exactly the same way about gender. It's not that I don't believe other people have a gender feeling. I just don't have one. And this colleague told me that meant that I was agender. And I said, but no, because I'm not. It's just an absence. It's not a political statement. It's not a stance. It's not a choice. It's not railing against anything. It's just an absence. And then when I looked up Stonewall right enough, the feeling that I have of an absence is under Ruth Hunt's definition. Yeah, I am in fact trans, which was a surprise to me.
So maybe you were right the first time. We all have a trans status. Yes, I see what you mean.
So if it's innate, then you would expect things that are innate to not change throughout the person's life. And there's a paper that I found from Canada looking at what happens in older age from people that have transitioned and then develop dementia. And some of them forget that they've transitioned, which is unusual because you don't forget what your sexuality is. So your sexual expression can change as your dementia progresses. You lose your libido or you become disinhibited, which is a real problem in residential homes, trying to manage people's behaviour. But I need to speak to a geriatrician about this, but I've not come across anybody that has come out once they're confused because they've been in the closet all the time. It's just not a thing that's reported. So why is it happening in the trans community that they forget their gender identity? And it would suggest to me that Stonewall are wrong and it's not innate.
And again, it's another thing that's presumably deeply distressing to these people who are going through it.
The paper is awful because there's it's patient accounts, it's case studies that they've looked at, and there's one person who transitioned in his 80s, which is unusual in itself, had the surgery, and then by the time they were 90 and in residential care, totally forgotten, was back to using their previous name and wanting to dress in male clothing, and was distressed every day because he had breasts and he didn't understand where they'd come from. And it's it's so appalling because that person has now got dementia. They can't consent to surgery to remove the breasts. They can't do that. They can't do that for him.
Right.
And it's just like something out of a Greek tragedy. Every day you get, who was it that had his liver picked at every day by an eagle?
Yeah. I can't remember.
And this poor guy, the only cure for that is to get so demented that you forget everything. It's just awful. It gives me the chills. Who did that to that person? Why? Actually, the Age UK have got this in their LGBTQIA plus sort of advice booklet, which is really important because previously, people that are LGB have not been well accommodated within elder care or within sexual health services, within maternity care. The sort of presumption is heteronormativity, and it's not a good thing. So it's great that these charities are looking at how to accommodate it, but they mention it in their elder care, and I think it's fascinating, and somebody needs to look at
it. As I said at the start, Elaine, you've been like a lot of people holding fire But I think recently you ran out of patience a little bit. Can you talk a little bit, just before we go, about what brought you onto this show, for instance, with me and Monster?
Yeah. I've been I've been trying to do the way that you should do, like, engage politically. I've been speaking to my elected representatives. I've been writing my emails. I've presented at Holyrood and Westminster and at the House of Lords on pelvic health related issues. And the House of Lords, Baroness Nicholson was doing our webinars, and I sent her that paper about dementia, and she had me on to speak about it. I have sent a lot of emails and been tiptoeing through trying to, find civil servants to talk to and say, well, what are we going to do about this? And then on International Women's Day, one of our ministers in Scotland, Shona Robson, made a speech that was all in tone. There was a debate about this in Holyrood, and it was all, we're speaking so nicely. The tone is really welcoming. And it was an absolute abomination. And then she had the stupidity to make a speech saying that no man would ever pretend to be something that
Yes,
he wasn't in order
that.
to harm women.
Extraordinary.
And I actually lost my temper at the telly. It wasn't a dignified moment, because I thought, there's no point. I'm wasting my time. These people, she's a woman. She knows fine well. By the time you're 12 years old as a female person about creepy men, because you get ogled by some guy that's 60 when you're 12. And you've got your wee training bra on, and you're going to meet your friends down the town, and you feel what male gaze is. And from that moment on, you're aware that some men seek to do you harm. And for Shona Robson to make that speech on the day that was the anniversary that a woman had been murdered by a man who pretended to be something that he wasn't. He pretended to be a police officer on duty, and he did the most appalling things to her. And my minister said that it just didn't happen. So I was being gaslighted from my parliament, and I just thought, a series of very Scottish expressions,
right,
which I wouldn't say in the BBC.
yeah. But I think that, talking to you today, I don't think anyone could be in any doubt as to where your sympathies are and where your compassion is. So thank you so much for coming on. I mean,
You're
really,
welcome.
it's just, you bring just such an interesting aspect to it. What's the word I'm looking for? An interesting view on it. And I really hope that you just continue to be spoken to and get into Parliament more. And we need you. Yeah, welcome aboard, if that makes sense. It's the more people who step up, the better. And it's just wonderful to have you on board. You're just going to change. I think you're going to change the debate,
Well, that's flattering. I'm surprised, because you shared that video that they took at Forth Valley Feminists, and they were messaging me today, and they think it's going to have 10,000 views today.
Oh, wow.
Which is just mad. And there's been quite a lot of feedback on Twitter. It's exclusively positive, apart from two messages. One from an anime avatar who said that this was the reason y'all didn't get the vote, which didn't have an apostrophe. So I judged.
Yeah. Good old y'all.
And the other one was from a very angry man who asked me, what about the trans women? And I laughed, because you can't talk about anything in women's health issues without some pillock jumping up going, what about the men?
Yeah.
Like, what about the trans women? Oh, right,
Yeah.
on cue. And that's all I've had so far. So I'm wondering if that means that things are changing, that maybe because of the Forstater case, and maybe because the paper was published, the international medics put the paper about the use of the importance of sex-based language in health. I don't know if there's now getting enough out there that people are maybe less keen to just call you names.
I think also I've noticed some other good signs. Apparently, I saw one person tweeting that very angrily that they had to stop using their pronoun badges at work because he said people were putting on the wrong ones. It's like, well, first of all, how do you know? But second of all, I think you're beginning to see a kind of ground level revolution against this stuff, And I think voices like yours will make it easier for other people to come out. So thank you again for everything so far. And I hope you'll come back and talk to us more.
I'll try and be funny.
Yeah, we'll try and do a funny one next time. Well, if you end with a laugh, it's almost as good. So that's okay. Elaine, thank you so much. I will finish up. Thanks to all the commenters. I couldn't really concentrate on it because I was starting too late, but thank you for contributing, and we'll see you next time. Bye-bye. Thanks again, Elaine.
Thanks, Graham. Thank you.